This month marks 1 year since dispensaries started selling recreational marijuana in Ohio. Last August, the lines were long. There was so much excitement, but for some, there were concerns too and fear about what more cannabis availability could actually mean. So tonight, we're following through on what's happened with health-related marijuana issues in Northeast Ohio 1 year later. News 5 investigator Jonathan Walsh with us now. And Jonathan, several local experts say the health problems, they are here.
As a matter of fact, yeah, some major drug treatment organizations, Rob, tell us they are helping people with severe cannabis issues and don't see it stopping anytime soon. They say having state-sanctioned marijuana is not good, but not all experts agree. For Joe Veronese,
the first thing I did, even before I drank, was smoke marijuana.
His early teen years,
it was alarming,
of smoking marijuana turned into real problems by his senior year of high school.
I had pretty much experimented with all substances, from opiates to cocaine to hallucinogenics.
It's the kind of experience that worries him and others with so much more marijuana now available in Ohio.
Why we would then want to bring another drug to the forefront.
Carol Negus is the director of nursing at the treatment center Stella Maris in Cleveland. The center says it has not seen a dramatic increase in marijuana-related cases in the past year since recreational cannabis started sales in Ohio. It does say cases of cannabis use disorder have gone from 1,900 to 10,000 since 2013, a disorder that can include disturbing effects.
A kid one time come in who thought he was a dog for 3 days, and all he smoked was marijuana. That was it. He thought he was a dog for 3 days. Crawled around on the floor, barking and drinking out of a water bowl.
She tells us she's seen a shift in attitudes about cannabis, people not taking it seriously. And some of the repeat client cases are also troubling.
The ones that come back that have relapsed, almost always the comment to me is, well, you know, I started smoking marijuana because that's not really what my drug of choice was.
We definitely see, an increase with the adult use customers.
We were there.
We're really excited to be in Cleveland.
When Clutch opened its downtown cannabis store on August 1st, its fourth shop overall in Ohio.
The state licensed dispensary, there's training requirements that we all have to follow.
Lauren DeLandy says at Clutch, they pride themselves on getting the right information to customers.
And we're taught as well to go over, the risks and the considerations with patients and customers as well. Definitely storage and locking it up, how important that is, and just how to use it, especially if you're new, starting low, going slow.
The state keeps track of cannabis sales. The first report came out last August. There's been a steady increase in edible sales with a peak of 110,000 and oil for vapes peaking at more than 178,000 during the same week last month.
I personally am in favor of legalization. I think
Dr. Ryan Marino is from University Hospitals.
There's a lot of safety and regulatory things that I think that can bring.
He says he also recognizes the risks, especially with today's products having high potency levels and higher dosages. But he tells us the fears some people had of emergency rooms flooding with marijuana-related problems just hasn't happened in the past year.
And I think nationwide it hasn't been that dramatic of a problem in terms of mass psychosis kind of effects.
The National Institutes of Health reported this year there is some evidence of increases in emergency department visits nationwide, but more studies need to be done. Cleveland Clinic says it's seen a gradual increase in marijuana-related visits to its emergency departments over the past 10 years. And the way the Cuyahoga County Board of Health keeps records, it does not include THC marijuana gummies. We do not have any data to offer, meaning it's not even tracking it. But for Carol at Stella Maris,
80% of the clients walking through the door smoke marijuana.
And for Joe, he's managed to stay sober for the last 5 years. He's now a counselor at Stella Maris, where he says he has seen more clients depressed and isolating themselves.
That could lead to other things, whether it's mental health issues, suicide, stuff like that. And people don't like to take that connection between mental health, marijuana, and suicide, but that's a real thing too.
The doctor at UH says people have reported health benefits from cannabis when it comes to things like nausea and cancer patients and problems with pain. Clutch Cannabis says some PTSD cases have been helped by THC. Meanwhile, the director of nursing at Stella Maris, Rob, tells us that she hopes those who are selling cannabis put some money aside to pay for the psychosis cases that will happen
in the future.
My goodness, Jonathan, great reporting again. And is there anybody left in the investigator's office? We were
We've had everybody on deck
My
here.
goodness. Nice job, all three of you. Okay, Ohio is one of 24 states, Washington, D.C. included, where recreational marijuana is now legal. 40 states and D.C. have medical marijuana programs. More than $700 million worth of recreational marijuana plant material and product have been sold at nearly 160 dispensaries across Ohio since legal sales began.